There is no substitute for temporal bone dissection to master temporal bone surgery. No substitute for temporal bone dissection cadaveric. Open cavity mastoidectomy. Open cavity mastoidectomy. Open cavity mastoidectomy is converting the middle ear, attic, and the mastoid cavity into single space. Middle ear, attic, and mastoid cavity. Middle ear, attic, and mastoid cavity into single space. Indications are invasive cholesteatoma involving the mastoid cavity, invasive cholesteatoma involving the mastoid cavity, discharging post-operative mastoid cavity, discharging post-operative mastoid cavity, recurrence of cholesteatoma after closed cavity procedure, recurrence of cholesteatoma after closed cavity procedure, recurrence of cholesteatoma after closed cavity procedure, extensive keratosis obturans with the destruction of canal walls, extensive keratosis obturans with the destruction of canal walls, extensive keratosis obturans with the destruction of canal walls. Procedure: by using large and short cutting burr, different size, cortical bone is removed till we achieve a circumferential saucerization without any bony overhangs. Large and short cutting burr of different size, cortical bone is removed till we achieve circumferential saucerization without any bony overhangs. Circumferential saucerization without any bony overhangs. Till we achieve circumferential saucerization without any bony overhangs. All the air cells are excentrated systematically to identify the superiorly middle cranial fossa dural plate, sinodural angle, superiorly middle cranial fossa dural plate, sinodural angle, and inferiorly the mastoid tip, and posteriorly sigmoid sinus and posterior fossa dural plate. Posteriorly the sigmoid sinus and the posterior fossa dural plate. Posteriorly the sigmoid sinus and posterior fossa dural plate. Posterior sigmoid sinus and posterior fossa dural plate. Posterior fossa dural plate. Saucerization helps in falling of surrounding soft tissues into the mastoid cavity and reduces the size of the cavity. Saucerization helps in falling of surrounding tissue into the mastoid cavity and then reduces the size of the cavity. Next, the root of zygoma and lateralmost part of superior wall. The root of zygoma and lateralmost part of superior wall and posterior meatal wall, except the bony wall. The root of zygoma and lateralmost part of superior wall and posterior meatal wall, except the bony wall over the ossicles and horizontal segment of facial nerve, is removed using large cutting burr without disturbing the ossicles. The root of zygoma and lateralmost part of superior wall and posterior meatal wall, except the bony wall over the ossicles. So root of zygoma, lateralmost part of the superior wall and posterior meatal wall, except bony wall over ossicles and horizontal segment of the facial nerve, is removed using large cutting burr without disturbing the ossicles. So the root of zygoma, lateralmost part of superior wall and posterior meatal wall, except the bony wall over ossicles and horizontal segment of facial nerve is spared. Ossicles and horizontal segment of facial nerve is spared. So done by using large cutting burr without disturbing the ossicles. Yes, disarticulate the IS joint, disarticulate the enclosed epithelial joint, and remove the incus. So mastoid tip cells, antrum, peritegmen air cells, sinodural angular cells, anterior buttress, posterior buttress. Anterior buttress and posterior buttress. Anterior buttress and posterior buttress. Next, tegmen plate, dome of the lateral semicircular canal, dome of the lateral semicircular canal, posterior meatal wall, posterior buttress, antrum. Using a diamond burr, remove the facial bridge. Using the diamond burr, remove the facial bridge. Bridge is the medial part of posterior-superior meatal wall that overlay the stapes and horizontal segment of facial nerve. Bridge is a medial part of the posterior-superior meatal wall. Bridge is medial of PSM. Posterior-superior meatus, medial part of the posterior-superior meatal wall that overlies the stapes and horizontal segment of facial nerve and communicates the anterior buttress to posterior meatal wall. Bridge communicates the anterior buttress to posterior meatal wall. Bridge communicates the anterior buttress to the posterior meatal wall. Bridge communicates the anterior buttress to posterior meatal wall. Bridge is removed gently using diamond burr without damaging the underlying vital structures like stapes and horizontal segment of facial nerve. Stapes and horizontal segment of facial nerve. This is bridge. Bridge communicates from the anterior buttress to posterior meatal wall. Bridge communicates the anterior buttress to posterior meatal wall. Bridge is removed gently using diamond burr without damaging the underlying vital structures like stapes and horizontal segment of the facial nerve. Next, stapes and horizontal segment of the facial nerve. So bridge. Next, reduce the facial ridge. Ridge is the posterior meatal wall that overlies the vertical portion of the facial nerve. Ridge is vertical. Ridge is vertical. R is V, vertical. Ridge is vertical. So ridge is vertical. Posterior meatal wall that overlies the vertical portion of the facial nerve. Next, landmark while lowering the facial ridge is horizontal semicircular canal. That is lateral semicircular canal. Chorda tympani, horizontal segment of the facial nerve, and pyramidal process. So landmark for ridge which is vertical. Ridge which is vertical is horizontal semicircular canal, horizontal segment of the facial nerve, chorda tympani, and pyramidal process. Facial ridge is reduced up to the level of dome of horizontal semicircular canal. Ridge is reduced up to the level of dome of horizontal semicircular canal. Ridge is reduced up to the level of dome of horizontal semicircular canal. Care is taken not to injure the facial nerve. Facial bridge, which is a horizontal part which is covering the stapes and horizontal segment of the facial nerve. Facial ridge is a vertical part. Posterior meatal wall that overlies the vertical portion of the facial nerve, and posterior buttress, mastoid tip, tegment plate, sinodural angle, and sigmoid sinus. While reducing the facial ridge, drilling is done parallel to the facial nerve. Initially using cutting burr. Once the chorda tympani is identified or blood vessels are seen running along the nerve, change over to diamond burr to avoid the injury to the nerve. Once chorda tympani is seen, identify the blood vessels, you have to change over to diamond burr. So ridge drilling done. Ridge is a vertical part. Drilling done parallel to facial nerve. Initially using cutting burr. Once using chorda tympani. Once you see the chorda tympani blood vessels, so you change over to diamond burr. Next, remove the anterior buttress. Anterior buttress is that part of the bone where superior bony meatal wall meets the tegment. Superior bony meatal wall, SBM, superior bony meatal wall meets the tegment. Superior bony meatal wall meets the tegment. So facial bridge, posterior buttress, and tegment plate. Next, removal of the anterior buttress. Anterior buttress is that part of the bone where superior bony meatal wall meets the tegment. Superior bony meatal wall meets the tegment is the anterior buttress. Anterior buttress is removed till the anterior canal wall, tegment tympani are same line. Anterior canal wall and tegment tympani are in same line. Till the anterior canal wall and tegment tympani are in the same line. Anterior canal wall and tegment tympani are in the same line. Attic space is widened by removing the anterior buttress. Anterior canal wall and tegment tympani are in the same line. Anterior buttress is removed and attic space is widened by removing the anterior buttress. Next, remove the posterior buttress, that part of the canal wall that meets the floor of external auditory canal. Remove the posterior buttress. Posterior buttress is that part of the canal wall that meets the floor of external auditory canal. Remove the buttress till floor of external auditory canal. And the mastoid tip is in the same line. Floor of the external auditory canal, floor of the EAC and mastoid tip in the same line. Remove the posterior buttress till floor of the EAC and mastoid tip in the same line. Remove the posterior buttress till floor of the EAC and mastoid tip are in the same line. So remove the anterior buttress till superior bony meatal wall meets the tegment. Remove the posterior buttress till the floor of EAC till the floor of EAC and mastoid tip are in the same line. Floor of EAC and mastoid tip in the same line. Anterior buttress is removed till the superior bony meatal wall meets the tegmen. Superior bony meatal wall meets the tegmen. Posterior buttress is removed till the floor of EAC and mastoid tip are in the same line. This prevents the post-operative collection of squamous debris in the mastoid tip. Prevents the post-operative collection of squamous debris in the mastoid tip by uniting the EAC floor and mastoid tip. Removal of anterior buttress. Removal of the facial ridge. Ridge is a vertical part. Next, facial ridge, posterior buttress. Facial ridge, posterior buttress, lateral semicircular canal, tegmen plate, sigmoid sinus, sinodural angle. Unreduced posterior buttress, adequately reduced facial ridge and lateral semicircular canal. Reduction of posterior buttress, lateral semicircular canal, tegmen plate. Further reducing the facial ridge. Now the whole cavity is polished using the diamond burr. A good open cavity is a smooth cavity without caves and humps. Saucerization of open cavity. 5 salient features of successful open cavity procedure are 5 features. Adequate reduction of facial ridge, which is a vertical part. Complete removal of facial bridge. Bridge is completely removed. Bridge has to be removed completely. Ridge has to be reduced. Bridge has to be removed. Removal of anterior and posterior buttress. Anterior buttress removal wherein superior bony meatal wall meets the tegmen. Posterior buttress is removed when floor of EAC meets the mastoid tip. A good saucerization of mastoid cavity and wide meatoplasty. 5 things are adequate reduction of ridge, removal of bridge, removal of anterior and posterior buttress, good saucerization of cavity, wide meatoplasty. Next, radical mastoidectomy. Radical mastoidectomy indications: extensive cholecystoma and granulations eroding into the labyrinth. Extensive cholecystoma and granulations eroding into the labyrinth. Procedure. Steps are similar to a modified open cavity mastoidectomy. So cochleariform process. CP is fractured after cutting the tensor tympani. CP is fractured after cutting TT. MEM scraped, middle mucosa scraped. Eustachian tube is blocked by first curating the mucosa of ET and tightly plugging with the periosteum and cartilage. So things important here are, a bridge is that part of the bridge is the medial part of the PSM. Which overlies the stapes and horizontal segment of the facial nerve. Communicates anterior buttress to posterior meatal wall. Ridge is the posterior meatal wall that overlies the vertical portion of the facial nerve. So to see the ridge, see the horizontal semicircular canal, horizontal segment of facial nerve, cauda tympani, CT, and pyramidal process, PP. HSCC, head segment of the facial nerve, CT and PP. Care is taken not to injure the facial nerve. Anterior buttress is removed until the anterior canal wall and tegmen tympani are in the same line. Anterior canal wall and tegmen tympani are in the same line. Posterior buttress is that part of the canal wall that meets the floor of the external artery canal, and the mastoid tip are in the same line.